Okay, Dr. Monica, thank you for joining us on the Clean Food Dirty Girl podcast today. I'm really honored to have you, and I'm really excited to talk with you. I don't think I've had a cardiologist on the show yet, and so thank you for making time out of your busy schedule. I know that you have a lot on your plate. You're doing a lot of awesome things, so thanks for making the time to talk with me this morning.
Oh yeah, no, it's my pleasure. I'm happy to be here.
And actually, I know it's not morning for you. It's 7 for me in Hawaii, but it's like 1 for you, East Coast, right? So
That's
clarify.
true. It is true. Although I may want to be in Hawaii right now, so I may live vicariously through you.
You got it. I am gonna be going snorkeling this morning. It's a beautiful morning for it. So
That's
um,
nice.
okay, so you are a cardiologist, and your background is really interesting. Um, you have a ton of credentials. You've done a ton of things. Can you just give us like a an overview of who you are, what you do, and how you got there? I mean, that's a lot of questions, but
No, it's all right. It's all good. So I am a preventive cardiologist. I'm board certified in four specialties of cardiology. So yes, I have been in school a long time. My area of passion, along with sort of cardiology, is prevention of disease. So I focus on using nutrition and lifestyle to heal the body. And I'm a board certified lipidologist. So that means that I work with people with very complex lipid or cholesterol problems. So the typical patient that comes to see me is somebody who has a risk factors, strong family history of heart disease, or they already have heart disease, and they are concerned about their risk and want to know how to decrease their risk. And then the third kind of person that comes to me often is somebody who just wants to see an alternate way of looking at their medical problem, and also with complex cholesterol problems where you can't be treated with standard therapies. What are the options that are available? So that's what I do as part of my job. I am the chair of the American College of Cardiology Nutrition Committee, which is really exciting. So this is my first year doing that, and so that means that I get to work with some of the greatest cardiologists who focus on nutrition in their practice, but also who are sort of at the top of their game and in terms of helping build guidelines for nutrition and how to teach nutrition to doctors. That's something that I'm involved in. And I'm also the medical director of Four Roots Farm, which is a farm in downtown Orlando where I get to work on improving food quality and how to get access or improve access to healthy foods to local communities, and how to improve and maximize the nutrient quality in food. And then I also do research at the University of Florida, and I recently published an article on olive oil, which was super fun and got a lot of funny press, which was different and fun to kind of work with. So that's me in a nutshell in terms of my work. I am married. I have three kids. I'm a runner. I am a triathlete. I love to do yoga, and the thing I like to do most of anything in the world, I love to sleep.
I can appreciate that. Very nice. So you're such an inspiration. You do all of these things that are so like some of these things I had no idea were even happening. So it's so cool to hear from you. So when I was talking to Dr. Barnard a few weeks back and he suggested that I get in touch with you, he did mention that olive oil study. So before we go any further, can you talk a little bit about that and share what was found?
Sure. So we at the University of Florida, I do a lot of research in nutrition. So one of the things I'm always interested in is understanding the why, because a lot of people have connections, and there's a lot of fluff in nutrition research, and there are a lot of people who are out there in the world that are touting take this supplement or take that, and so it's very important to me to be on the right side of the science. And so I like to ask the question of the why or how, and understand, is this actually the medicine or the supplement that's working, or this food that's working, or is it just a class, or is it one specific thing, or is it that they've changed everything? And so I like to ask questions like that. So one of the things that I've been very interested in for several years, or for some time now really, is whether, for similar reasons, is the Mediterranean diet, which gets a lot of hype and attention, a good diet and and so we know from data that a Mediterranean diet compared to a standard Western diet is absolutely better, and so we should
Yeah.
eat more that way. But what is it about the Mediterranean diet that's actually so good? And how is it different than, say, a whole food plant-based diet, which is a Mediterranean diet? So if a Mediterranean diet is a whole food plant-based diet with some other pieces, right? It has additive olive oil. There's more liberal use of salmon and fish. There's a little bit of poultry and a little bit of wine. So there's these different nuances and components. But overall, it's a plant-based diet with a few additives, and specifically olive oil. So one of the things had been wondering was, well, is a Mediterranean diet so great compared to something that actually maybe a little bit cleaner, like a whole food plant-based diet? Which is actually better, or are they about the same? And is there a specific component that makes one better than the other? So specifically, I wanted to look at olive oil because olive oil is touted as sort of the best thing since sliced bread, right? And sort of, to use an old sort of euphemistic word, and ironically, sliced bread's probably not so good, but to sort of understand, is olive oil really that good, and or is it just that they're eating more plant based? So I decided to create a study where I put people who are at risk for heart disease, and I put them on a plant-based diet. And what I did was I did it as a crossover design. So the same people would start out, they had to start out on a Western diet, and then I moved them to a whole food plant-based diet. And for 4 weeks, they ate high olive oil, then they washed it out, and then 4 weeks, they ate low olive oil. And then I had another group that started low and then went high. And
Oh,
what I was able to do was then specifically look at the relationship of how their cholesterol changed based on eating the same foods throughout, right? But that all I did was adjust one factor, and that was the oil. And what we were able to find was that actually that the patients who ate higher amounts of olive oil, actually when they were in the high olive oil cohort, they actually didn't have as much impact on their LDL cholesterol, which is the bad cholesterol, as they did when they were on the low olive oil group. And that's a pretty impactful thing to see. And that we were able to say that maybe the patients who ate a whole food plant based diet and a low olive oil on a daily basis, actually maybe their cholesterol does better than people with high olive oil, suggesting that maybe we should be eating less oil than more. Now that's important because remember, what you may not realize is that for every 39-point drop in LDL, so remember LDL is the bad cholesterol, for every 39-point drop in LDL, I can decrease your risk or improve your mortality by 22%. So using that LDL as a surrogate marker for outcomes is very important to show that I was able to reduce LDL further on low oil is actually quite impactful.
interesting. Was that fun to do that study?
It was fun and not fun. So we were doing it during COVID, and so
Oh,
that's
okay.
always tricky. But it actually led to a lot of nuance because
Oh,
we did the cooking classes. So everybody was part of a cooking class, and that was actually a fabulous part of the program. And we did it on Zoom, and so people loved it. Like it was this community. Actually, once the study finished, they didn't want to disband. Like they all shared numbers, and they had become a community. And so what we found was actually Zoom education is extremely effective. People like being in their own houses and their own kitchens and having conversations from their own homes. And the compliance rate with those programs was so high. And
mm.
so was it fun to do? It's hard to recruit during a pandemic for a research study for sure, but we actually made lemonade out of lemons, and we were able to create a Zoom class that people loved and create a community. And maybe to me, that's actually one of the best parts of the whole thing, is that we
Mm.
created a community of connected people who were interested in fixing their nutrition, and improving and decreasing their risk. And what's more beautiful than that?
So you said that there was some funny comments. How was that study received?
You know, I think anytime you touch a sensitive topic like olive oil, especially when there's a large amount of data and a lot of people involved in olive oil and oil in general, I think it becomes complicated to pick the scab there and to sort of say, wait a second, maybe this isn't the golden
Hmm.
choice, the golden apple, so to speak. And so, I think what we can say, what I like to tell people is this definitive? No. This was a small study that had some problems with it. We had some crossover effect and some design issues that affected our data. At the same time, and so what we can safely say is that we asked an important question. We got an answer that surprised a lot of people, and definitely warrants further study. And
Hmm.
so, what we want to do here, yeah, a lot of people didn't like that we said maybe olive oil is not so good, but I don't, the science is the science. We look at it for what it is, and we should at least take it and say, gosh, we should do a bigger study here and check if we can see the same results.
Hmm. Hmm. Yeah. And yeah, because olive oil is so ingrained in people's lives to be this very healthy thing. And I know that when we're talking about a whole food plant-based diet, most people can get on board with like the more veggies and the more fruits and the more whole plant foods. And as soon as you say, okay, no oil, people are like, what? And it's something that I think people need to ease into. That's what I found in our community. But it's interesting because once you stop cooking with oil, you realize actually you don't really need it. That was a surprise for me when I started doing that years ago. So,
Yeah.
do you
I
have
mean, I
any?
think the other thing that you should take away is that in the study, the people who were in the low oil group, they still got a lot of fat in their diet. And that's important. It was like 32% still fat
Uh,
in the low olive oil diet, which is not low fat. And so
yeah.
and people who were eating 32%, they were still getting the fat intake, well, from natural fruit and whole food sources like avocado, which was a
Hmm.
big source of fat that we were getting in the people were getting in the low olive oil group, and they still did better. And just
Hmm.
reminding us that sort of plant-based sources, like it's not that are not so concentrated like an oil, are better choices for getting those fats and having those calories than eating it as an oil. Remember, oil is just this compressed 14 grams of fat kind of per tablespoon or whatever it is, food that we're using and saying it's healthy. Well, gosh, wouldn't I rather you eat 10 or 15 olives than eat the olive oil? Heck yeah.
Hmm. Yeah, it makes sense. That makes sense. So, how did you get into preventative medicine? I imagine that this change happened as you were like it didn't happen before. Did it happen before you went into your training, or is this something that happened along the way?
Well, I'm Indian by birth. So I grew up in a family that believes in sort of less is more. Ayurveda and sort of some of that more natural medicine that is classically considered Eastern medicine is something I just naturally grew up in. Turmeric was
Mm.
part of my daily eating, as growing up, and something that's how I grew up. And so I think it's always been a part of me. And when I was in training, it's definitely like beaten out of you. But halfway through my cardiology fellowship, I participated in an integrated medicine fellowship with Andy Weil, who's become a friend, and he actually wrote the foreword to my book. And so I participated in that. So I've always sort of been interested in it. I used to run prevention workshops even when I was a junior faculty and young new doctor. But I didn't get so involved in the nutrition part of it. Like I would sort of more be focused on, hey, if your blood pressure is high, you should get it dealt with because these are the things that you're decreasing risk and checking cholesterol and getting people on the right meds. But it was only when I myself got sick, after I had my third child, that I started understanding and learning about the impact of nutrition, and really spent a lot of time learning about the gut biome and how impact of your nutrition and lifestyle can affect that. Because I think when you get an illness and you're told that you have an illness that you're not is incurable, and that you're going to be on medicine for the rest of your life, and everyone you talk to says, yeah, there's nothing else you can do, you just have to kind of deal with it. I think you kind of hit rock bottom, and you kind of
Mm.
look at it and you have to sort of say to yourself, like, really, is that it? Is anything? And I have all these resources at my disposal as a physician and all the stuff I've studied along the way. And really, there's nothing else I can do. And so it really started me on this path to trying to understand these other pieces. Like, what else can I do to heal my body? So I think that was, that was certainly the big shift that made me go back to prevention, because I was able to heal my own as I was able to heal myself. I realized that, gosh, there's so much I can do to help people besides the medication. And it's not that medicine isn't good or we shouldn't be considering medicine, but certainly there are so many options to add to that. And so much of the time, people can come off their medicine.
Mm-hmm. Do you mind sharing what illness you were experiencing at that point?
Yeah, no, I was told I had a debilitating form of rheumatoid arthritis and that my prognosis was overall very poor.
Mm. And you said, well, maybe not.
Well, I think it's hard to get a diagnosis like that. Those are dark times in my life. And still to this day, my stomach turns when I think about it or talk
Mm.
about it. And, I had 3 kids under 4 years old. And I was
Yeah.
sort of told that I was going to be on meds for the rest of my life. And I had to stop nursing my kid, and that, I couldn't even walk, and I was wobbling. And, it's a sobering feeling. And so I think everybody is looking for hope.
Mm.
And I wasn't given any hope. And one thing that I try to do in my practice is I give people hope, and I make them feel empowered that they can heal their bodies. And so maybe not everybody's going to get cured, but that's not the point. The point is to make people better. And
Mm.
I'm not naive that I will cure everyone or make everybody off meds or fix heart disease, or people are not going to have stents or bypass at all ever again. But I can surely say that we are making people better.
Mm-hmm. Mm-hmm. Well, thank you for sharing that. It's really inspiring, the work that you've done. So I have, like I told you before I hit record, I had asked our community if they have questions for you, and people were really excited that I was talking with you today. So I'm gonna start asking you some questions from our community, um, if that works for you.
Sounds great.
Okay, this first question from Amy: why do many whole food plant-based vegans have elevated triglycerides? Dr. Garth Davis apparently addressed this many years ago, but I never found his response. And he suggests not fasting long is usually recommended for blood tests.
Not
Um,
fasting long is good for blood tests.
yeah. He suggests that not fasting as long as usually recommended for blood tests. I just don't know why and would like to understand the thinking behind it and whether this doctor agrees or sees similar results. Um, so why do many whole food plant-based vegans have elevated triglycerides? I guess is kind of the root of her question.
Yeah, so I do see elevated triglycerides. Often, I find that people who are having elevated triglycerides are often eating too many simple carbs, and that's where I'm finding the issue with the triglycerides in whole food plant based people. So, one of the things I think we can get tricked with in eating plant based is that a lot of people are so nervous to eat certain foods that they eat less and then compensate by snacking
Mm.
on sort of simple carbs, and that's something I find a lot of. And so, what I think is important to do when you are whole food plant based is really be intentional about what you're putting in your body and making sure you're getting more. And a lot of people in the plant based world sort of pull away from thinking about macronutrients. And I did as well for a little while, but I actually find that the problem we're having now is that people are not intentional about their food intake and are not, including myself. For instance, I found that I was actually eating very little protein and I was very hungry. And so I would compensate by eating a lot of carbohydrates. And I wasn't feeling full and I was feeling very tired. And so I found that just by focusing on being more intentional about with each meal, making sure that I'm getting enough of the healthy fats and getting enough healthy proteins, that I actually reduced my triglycerides, which were actually elevated as well, around 150, 160, and dropped them into the 80s by just being more intentional about not eating simple carbohydrates, being more intentional about getting some of those other macronutrients that we as plant based people often neglect.
Mm-hmm. And can you give examples of simple carbohydrates for people who are wondering?
Yeah, so simple carbohydrates are things that make that are simple to process. So typically, those are things like crackers and chips. These are our sweets, our cookies, and our cakes. And it's also sometimes it can be white rice for people because white rice, remember,
Hmm.
has minimal fiber. And simple pastas, which is another big one, is sort of these semolina pastas that are out there. So those things can be simple, but truthfully, fruits are also simple carbohydrates too, right? And so people always say, well, why not? Why can fruits be eaten and not crackers? Well, remember, fruits have so much more to them than just being a, yes, they may be simpler,
Hmm.
but they're loaded in fiber and they have so many phytonutrients and vitamins and minerals that we need.
Yeah. All right. Awesome. Okay, so Julie asks, how important is the HSCRP number? And I'm not sure what that means. I'm sure you do.
HSCRP is a high sensitivity CRP or C reactive protein. It's an inflammatory marker and it's a measure of inflammation and is more specific to the heart than maybe CRP, which is something we check is as a systemic marker, but high sensitivity is more specific to the heart. So, is it important? It is important. I use it. I test it. I do draw that lab, but I don't take it in isolation. So I think it's important to understand that high sensitivity CRP is just one test that we do as cardiologists to assess risk, and really understanding each person individually is extremely important. Like I wouldn't just treat somebody or not treat somebody based on a high sensitivity CRP. I really need to see the whole package. I need to understand who the person is, how old they are, what their other risk factors are, what their cholesterol looks like before I would make a decision based on that. But there is data to show that people with a high sensitivity CRP that's elevated, especially who have low LDL or even high LDL, like despite your LDL, having that high sensitivity CRP does increase your risk of heart events. And so understanding why that's high is important, and whether that needs to be dealt with is something that should be discussed with your physician.
Okay, great. Okay, so Andrea asks, does dietary cholesterol affect heart health?
That's a good question. Maybe. And so I know that sounds like a crazy answer because for years we thought for sure that the amount of, cholesterol we would say sort of no cholesterol in your diet. Then there's a series of people that say high cholesterol is okay because your body regulates it. The answer is
Mm.
somewhere in the middle. In general, yes, your body does make cholesterol, but we eat too much cholesterol in our diets. And so trying to avoid eating excess amounts of cholesterol in your diet, I think, is important. Remember, cholesterol comes from primarily from animal, it does come from animal products. And so in the center of a yolk, for instance, has like 89 milligrams of cholesterol. And so in general, we want to stay sort of lower than 200 milligrams of cholesterol in your diet per day. Is sort of a general rule that most of us use, but we still believe that less is more. The key
Okay.
is not as much cholesterol, though, that I focus on and really focus on saturated fat. And saturated fat is really what we want to avoid in general. And so watching your saturated fat intake is most important.
Okay. Okay. How can a plant-based diet help a family history of high cholesterol, like familia hypercholesterolemia?
Okay,
I don't
so
think I said it right.
somebody has familial hypercholesterolemia. That means they have a genetic predisposition to high cholesterol, typically because usually, so LDL is this little like Goomba guy that kind of floats around, right, and causes plaque. And then your liver has these receptors called LDL receptors, and what they're supposed to do is grab the LDL and then dispose of it, right? And so people who have problems often with familial hypercholesterolemia have a defective receptor, and so their cholesterol can float around, and so they tend to have
Mhm.
higher LDL cholesterols than other people, and they can be thin and lean and still have familial hypercholesterolemia, and that's something that's just genetic. One in 400,000 people have familial hypercholesterolemia. I take care of hundreds and hundreds of patients with this condition, and it's hard to reconcile for them that there's this is a genetic condition, and many people who have familial hypercholesterolemia will end up on medication because remember, there's something genetically abnormal. This is not something you did. Now, with that in mind, changing your diet absolutely will help. So, eating a whole food plant based diet will get your numbers lower for sure. It's just that you may not get out of being on medicine completely, but you certainly can reduce your numbers overall by changing your diet. The way to think about this, and Kim Williams and I were talking the other day, and we were just talking about something, and he said something, or one of us said something. We're just like, what? Imagine if you didn't change your diet, and that's the way you should think about things. Is that at the end of the day, we're still at risk as whole food plant based people. We just still get sick, we still get illnesses, and some people have trouble grappling with that. But imagine if we didn't change our diet, then our risk goes up so much higher. And so, as an FH patient, which is what this is called, familial hypercholesterolemia, changing your diet and changing to more whole food plant based is absolutely helpful. Will it get you out of medicine all the way? Maybe not, but imagine if you didn't do the dietary change.
Yeah, it's a good point and a good way to look at it. Any advice for those with high blood pressure?
The European Society of Cardiology guidelines came out last week, and we're actually changing. And we expect the American College to shift as well towards even more aggressive management of blood pressure, and saying really that anything even above 120s is high blood pressure. And that's tricky, right? Because now, based on even the guidelines from a few years ago, almost 50% of Americans have high blood pressure. It's a tricky problem. And so, in that, with these guideline changes and the more tightness of our guidelines, it's just going to be more and more people. And so, we're living in a high stress world of obese people. 70% of Americans are now considered overweight or obese. So we're struggling with a lot of the weight. We're struggling with a lot of people eating more processed foods and high salt foods, all of which are worsening our blood pressure issues. So advice, heck, I have a load of advice. There's so many things you can do to bring your blood pressure down. Weight loss, high potassium rich foods. So eating any food, sodium and potassium live on a pump. And so when you increase sodium, your blood pressure goes up, and potassium kind of gets shot out. That's how the pump works in your body. So it's simplistic, but a way to think about it. So if you eat potassium rich, remember sodium and potassium are on a pump. If you eat potassium, you flip the pump the other way, and the sodium gets kicked out. So when you eat high potassium rich foods, you're actually going to bring your blood pressure down. So should you eat potassium rich foods every single day for the rest of your life? Yes. So that's like, beets and tomatoes and avocados. And everybody says banana, but banana is actually just a moderately high potassium product, whereas avocado and beans and tomatoes are really high in potassium. Sweet potatoes, exercise, awesome. Weight loss, if you have sleep apnea, getting your sleep apnea treated, all of those things would be helpful for people with high blood pressure.
Great. How long does it take to reverse, this is from Anita, how long does it take to reverse the damage already done from eating unhealthily for years?
Yeah, it's a tricky question, and one that, is very individual. Some people, remember, I don't think the goal is necessarily reversal. I think the goal is at least stabilization. And often I'll tell patients who come in with that question, I'll say, look, I don't know if I'm going to reverse your disease, but I'm going to stabilize it. And so, maybe I'll be lucky enough to reverse it. And so I think what you should focus on is not making sure that there's no more production of, plaque or whatever that risk factor wasn't described in the question. So, and the number of years is very individual, and how aggressive and how you're able to change and what the numbers look like. That's why it's really important to have a good doctor who can understand your goals, who's focused on you, who understands your risk factors, and finding somebody who can help you with that is very important.
Okay. Let's see. Barbara says or asks, I am a heart attack survivor. Why do most cardiologists not even inquire about nutrition or exercise, much less non-pharmaceutical supplements, only meds and blood work?
Yeah, it's sad. I mean, the reality is Doctors aren't dumb. It's just that they're not taught right. So when we go in medical school, we get very little education on nutrition and lifestyle. It's ironic because the answer to every question on the test is nutrition and lifestyle changes, but nobody actually teaches it. I used to teach at the University of Florida nutrition. I used to give classes there. I give them at the University of Central Florida in their medical school. So, but there are not a whole lot of medical schools that are teaching nutrition aggressively. And so people and physicians just don't know it. And so, we did a study on this years ago. We looked at cardiologists, and very few cardiologists feel like they have good nutrition education during their training. And so how can they then give out the education if they never got it, right? And so that's the problem. And there's just a few of us that have actually gone out and gotten additional understanding and education. That's why we're able to effectively deliver that education. It's a difficult situation, but find people to put on your team who can advocate for you, who understand you. And there's now options and resources through telehealth where you can access great doctors all over. And so just be your advocate, and don't be cavalier. So the other thing is that don't ignore it and put it under the covers. It's not because medicines, especially post heart attack, are important, but there's so much you can do with nutrition and lifestyle. So I don't want you to ignore it, but I want you to kind of embrace it, find the people and you can put on your team who can help you in this journey.
Mm-hmm. That's great. Um, okay, should MCT oil be avoided? It seems to be showing up in more vegan products, protein and superfood drinks especially, and promoted as healthy.
Yeah, it's a great question, actually. Your audience has great questions. The answer is I don't know for sure. I think the data leans me towards not using MCT oils. But I think there's more study that needs to be done. I do see them too in a lot of these protein supplements nowadays. There was one I saw the other day, somebody sent me and said, "Hey, can I take this?" And I do take a protein supplement periodically, but I use one that has no MCT oils.
Okay. Okay. Why do women have different symptoms while having a heart attack from men? For instance, I had sharp stabbing pain in my stomach and no chest, arm, or jaw pain.
Yeah, it's so tricky, right? And so that's why it's so important for women. We're trying to do a large movement to build up awareness in the way women present than men. I mean, I don't, you know, yes, we're different. We're a different animal. We present differently. The problem is really that there's no awareness of the way we are different, and that's a problem in so many ways. And so the problem is we present differently as women. So classically, women can have chest pressure, chest pain, jaw pain, but often they'll have shortness of breath. I had a woman once who had a heart attack in front of me, and her symptom was nausea and vomiting, and so we all thought she had a stomach bug at first. So it's tricky until it's tricky sometimes to pinpoint, but awareness of the symptoms is very important, and that we as women present differently. But it is a huge campaign going on to build awareness of women, because remember, when women get to the emergency room, it takes longer for them to get diagnosed. Actually, it takes longer for them to get treated, and they overall do worse because of the longer time in between, and because they're not diagnosed as well as effectively. And also, women in ourselves, we need to be more aware of our symptoms, because so much of the time we're the caregivers and we're like, oh, it's fine, and we kind of ignore our own health, and we aren't taking care of ourselves, and so we often will miss our own symptoms or delay getting treatment when we have a symptom. So I often tell women, I say, look, if you have a symptom that gets worse with exertion, if you're doing something and you get a little bit more winded or a little uneasy or something that happens with exertion, that's a symptom that you should go see a doctor about. Worst case scenario, you get a stress test or you have to get your heart arteries checked by a CT or something, but at least you'll know and have the peace of mind. And I put a lot of stake into that peace of mind. I am not afraid to get imaging if I need it. Even on myself, I've had a CT angiogram of my own heart arteries, because I sometimes you just need that peace of mind.
Mm-hmm. Mm-hmm. Are there any other symptoms that you've seen specifically in women that are common that we should look for?
Most of the time, I've seen exertional shortness of breath, so they
Okay.
just feel a little bit more winded, and that's what makes it tricky. Is that
Right.
that shortness of breath is like, is it because I'm out of shape or because
Mm-hmm.
I am just short-winded? And so often, or it's because I'm short-winded, and so often I'll tell people, think about you walking next to your friends, and if you're able to keep up with them, and you're all about the same level of breathiness, then you're probably okay. But if everyone else is moving forward, and you're like, gosh, I just can't keep up, that's something that you need to have evaluated. The other thing is sort of that nausea. I did have one woman who her symptom was teeth pain. And but again, things that get worse with exertion is always a key.
Okay. All right. Okay. Do you believe that reversing atherosclerosis is possible? What are your thoughts on oils, nuts, and seeds for those with known CVD?
Yeah, so maybe is the answer. There's some trials that suggest plaque regression is possible. Um, maybe. As I said earlier, I think that what we should focus on is not reversal, but stabilization. And if we're lucky, maybe we'll get some reversal. Um, I think the focus should be whatever you have, let's stabilize it. I always tell people, like, you have a heart artery and you got some plaque in it. And our job is to hammer that plaque against the wall so it doesn't become a problem for you and blood can flow through the blood vessel, right? And
Mm,
so that's my goal for everybody.
right.
Can people who eat plant-based or who have had heart disease, can they eat nuts, seeds, oil? Depends. Every person is different. Most of the time, I do include nuts and seeds in my heart disease patients' diet, but it depends on what they're doing. Some people I'll restrict everything from the beginning, and then I'll add back slowly. Sometimes I will. They're losing too much weight, and so I need to add back healthy sources of fat. I'm not a big oil fan. I've gone a lot, if you follow my book and you follow my history, in different times of my life, I've been more pro oil than less. But I think the data continues to show us that getting your fats through healthy food is the better alternative. So I don't, I tell people, don't use oil in your food for your health. If you need to cook a little bit with it here or there, well, okay, but I wouldn't eat it for your health.
Mm-hmm. And nuts and seeds, okay, depending on the
Yeah,
person and
yeah.
what's going
You
on.
know, yeah. It just depends on the person and how much weight they have, how
Mm-hmm.
much they're carrying, how inflamed they are, how much angina they're having. So it depends on the person. I have some patients that I've restricted everything for 3 months, and then I might
Mm-hmm.
gradually add back.
Okay. Joe has a question. Thoughts on estrogen replacement menopause?
That's a great question. I'm impressed with your audience. Really great people, great questions, and because but each of them unfortunately is a complicated question in the sense
Yes.
that hormone replacement is also a very complicated question. And so for years we said take, remember, and then we were saying take hormone replacement, you lose your estrogen, let's give it back, right? And then we realized people were dying because we were giving them hormone replacement therapy. And then we went the other way and took it out of everybody's life, and so everybody had to go through this quick menopauses back when the HERS trial came out. And so that was also not right. But we panicked. We're like, oh my God, we're so wrong about this. And we took it out of everybody's life. But now that we've come to it, we do see that there may be a space for hormone replacement therapy. It just depends, again, on the individual. And I know that's hard for people who come to these podcasts and want sort of a global answer of this is what I should do, but it really does depend on the person. For instance, if you have no history of breast cancer and you have no heart disease, like a calcium score of 0, and you're 50 years old and you're going through menopause, I'll probably allow hormone replacement therapy for maybe 10 years. But if you have heart disease, or I'm less likely to allow or condone hormone replacement therapy in those situations. And then we look for alternate options like creams, different natural products. Flax seeds, for instance, are great hormone stabilizers, and something that adding especially you should be eating it on a regular as it is, but as you get perimenopausal, a great addition.
Okay. Great. Okay, so Cheryl says, I hear mixed opinions about LDL cholesterol levels. Is there evidence, or what is the evidence for the recommendation of 70 when I've always been told that under 100 is normal?
it depends on the patient. So, um, if you have no heart disease, we're going to be less. So, less is better. When you're born, your LDL is 40 to 50. And I like people to know that
Mm.
because we can build a baby into an adult with an LDL of 40 to 50. So you don't need a whole lot of cholesterol because people are always talking about, especially the keto people, love to talk about how you need cholesterol to build your cell membranes. Well, yeah, you need some, but you don't need a whole lot. And so I think that's what
Mm.
people get caught on. And so, but so depending on now, if we whether you need treatment or not is based on how significant your risk factor profile is. And so many people an LDL of 100 is fine. Should we all aim for an LDL of 50 to 40 to 50? It'd be nice, but most of my patients who are eating plant-based live in the 70s to 80s, and those are good numbers. And I don't you don't necessarily most of those people are not going to need treatment. And so it just depends on the person and the scenario. If you already have heart disease, we are definitely more aggressive with treating your LDL cholesterol. So when you hear 70, those are patients we're talking about who already have heart disease. And so we are absolutely more aggressive with those people. Whereas people who don't have heart disease, there may be more room for change. Either way, eating more plant based is the key. You have to be eating those kind of low oil plant based foods to reduce those numbers because we still want your numbers down, whether that's through lifestyle or medicine. Why wouldn't you use lifestyle first so you can, if you need medicine, it would be less, or maybe you don't need any.
Okay, clear. Okay, something I had a hard time discussing with my dad. This is from Melissa. Heart health diet versus or with diabetes, type 2 diabetes diet. My dad insisted following diabetes advice for no carbs, including no or low veggies.
Yeah. That really isn't the guideline. And unfortunately, there's still some people that are saying that. And the guidelines, even in the American Diabetic Association, are to eat more whole food plant based, so more plant forward eating and low carbohydrate. And when they're talking about low carbs, they're not saying no carbs. And they're not saying don't eat complex carbs, right? Which is, fruits and vegetables, like those are good for your body. There's so many benefits to fruits and vegetables. And so it's not correct to tell people they can't eat vegetables. And that hurts me a little bit to hear that. And so a lot of times, you know, and then what ends up happening, sadly, is that person who has been told to eat no fruits and vegetables is hungry and they're going out and eating a cookie. Right. And
Mm-hmm.
so we see this over and over again where people are told to restrict this or that and these sort of healthy plant based foods because they're carbohydrates. And then they literally go out and eat crackers and chips and their sugars go up. But, oh, I can't eat this food because it's going to make my sugar go up. Okay, wait, hold on a second. And 9 out of 10 times when I work with a diabetic, and I have a load of diabetics in my clinic and that I work with, and we just have to cut. What we work on is eating foods that don't trigger your insulin to go up quickly, right? So low glycemic foods that are high in fiber that you metabolize slowly, and then those things help reduce your tummy, which is actually, remember, when you have more adiposity or tummy fat, you're more prone to getting insulin resistance, right? And so getting people to trim down by eating sort of more plant-based, high fiber, low sugar foods is going to that's what's going to reduce their diabetes risk. So it saddens me when I hear people say stuff like that. And I would encourage your father to maybe watch some videos on healthy eating. There's some on my website at drmonicaggarwal.com, but you can go to fullplateliving.org. You can go to the American College of Lifestyle Medicine has a few. I mean, that can hopefully help your dad understand sort of what a healthy carbohydrate looks like in an unhealthy one.
Okay, and we will link those resources in the show notes too for anybody who wants more information. Um, okay, and here's the last question. Tammy asks, I would like to know how best to control triglycerides. I would also like to know if there are tests you recommend with a family history of heart disease to help them anticipate what might be coming to prevent heart disease.
Yeah, good questions. So So things to reduce triglycerides are really, again, those simple carbohydrates. Most people are eating just way too much food for their bodies, and some
Mm,
people are eating really healthy food, but they're eating too much of it.
yeah.
So sometimes restricting eating after certain times, everybody's talking about time restricted feeding and intermittent fasting, whatever you want to call it. We're just trying to cut the amount of maybe intake you're having.
Mm,
And so during especially those snacking hours, which is, that's after dinner time till 10 o'clock at night is what we call the snacking hours, right? And so kind of avoiding those things, really trying to eat complex foods that take time to chew and to
mm, mhm.
reduce your risk. Um, The second part of the question is there any screening you can do? Yeah. I mean, we're really moving towards a lot of screening, testing, and evaluation. You can get a carotid ultrasound, you get a coronary calcium score. Some people are getting CT angiograms, which is what I had. There's even more advanced CT scans now available. People who don't want to do radiation can, get a really nice profile of their cholesterol and some of the advanced markers from a doctor who knows how to assess risk.
Mhm.
Unfortunately, not everybody is doing a great job assessing risk and prevention, so finding a good doctor in this space is important.
Okay. That's great. And when you said low carb earlier, I just want to clarify low simple carb, meaning low simple carb.
Yep.
Okay. Um, I had one question come up just as we were talking about LDL. If someone has an LDL that's like, I don't know, from 70 to 100, for example, where do you like to see the HDL?
Again, it's very tricky because it has to really be considered individually. So if somebody has a 70 to 100 LDL and they're no risk factors, no high blood pressure, remember I can do a risk assessment based on all of these parameters, and I could shoot you out a risk based on a calculator to give you your 10-year risk of events, and that number is actually extremely helpful.
Mm,
But based on the fact that I don't know a whole lot of information, but I just assuming you have no heart disease at all, and you're maybe a younger person who just has a cholesterol between 70 and 100. And if you're a man, an LDL, I mean, HDL above 40 is fine. And for a woman, we like that HDL be above 50.
okay. And to increase HDL, if your HDL is a little bit low, how can you increase HDL?
So it'd be nice if you have estrogen. So women have higher HDL than men, and when they go through menopause, their HDL will go down. So that's always tricky. Activity is the biggest
Okay.
way to increase HDL. A little bit of alcohol. Again, I'm not a believer in alcohol because there are a lot of negative effects in alcohol, but there is some data that people like to say that HDL will go up with that. Um, Activity I find is to be the most effective way to increase HDL. Niacin will increase your HDL, but niacin hasn't really panned out as a good drug for heart disease, especially if you're taking a statin. But some people have found that niacin is effective for bringing HDL up. That doesn't mean it's decreasing your risk, and that's the key.
Mm,
Remember, just because we increase or decrease a number, you have to ask yourself the next question, which is, does that actually decrease risk? Sometimes we fix a number, but we don't fix the problem, right? And so we have to be
mhm.
careful with that. And what we found with niacin is we fixed a number, but we didn't fix the problem.
Okay. Okay, well, thank you. You're very generous with your knowledge, and I know that our community is going to be super happy to hear this. And you really clarified a lot as much as you can, because what I'm gaining from this is it's very individual and it really depends from person to person. So it's important to get a good doctor to understand your full risk factors for heart
Yeah, I mean,
disease.
I wish I could do. I wish I could sort of give you these blanket numbers, which is what I know a lot of people on the podcast want to know. It's like, well, where do I fit in these
Yeah.
numbers, and how should I be more or less aggressive? In general, a person without heart disease, we want your LDL to be under 100 and your HDL for a woman over 50. Is that perfect? Should it be better or worse? I can't give you anything bigger or better than that. For people who have heart disease, their LDL should be under 70, but really closer to 50 to 70, because and not to worry about and most people are worried about statins, and they think those things are the devil, or they're going to make them lose their memory, or and there's a lot of negative press about statins. But statins are not bad drugs, and most people do extremely well with them, and they have loads of data. So while I believe in plant-based eating 100%, I also don't want to throw the baby out with the bathwater, which means that there are medicines that are extremely effective. And I think that as a community, we need to embrace everybody, not make the people who need to take medicines feel bad of that
Mm-hmm.
they failed, because you didn't fail if you need medicine. You always remember what Kim and I were talking about, which is, imagine if you didn't change your diet, how much worse it would be.
Mm-hmm. Mm-hmm. So to wrap up, if you had to give somebody like three tips for to take care of their heart, what would they be?
If I had to give them three tips, I would say number one, increase your fiber, increase your fiber intake, and like my funny thing that my kids hate when I say is, the more you poo, the better you do. But that's absolutely true. So increase your fiber intake. And people who say that beans don't agree with them, or things make them bloated, we should not walk away from those. It means that our body needs those. They're just not used to them. And so sometimes you have to just go slowly and be more deliberate. The second thing is reduce your saturated fat. Do not be eating saturated fat. Really watch the amount of most of the saturated fats coming from animal products, but there are some plant products that have saturated fat too. So if you eat 15 avocados, you're going to get a decent amount of saturated fat. The third thing I would say is you got to move. You got to move. Even if you have trouble and you have arthritis, find a swimming pool, find an alternative, find chair yoga, find anything that you can do to move. And if I add a fourth one, it would be like try to be happy. Try to find ways to find some joy and laughter in your life, because life's hard, and having some joy definitely reduces risk.
Okay. Those are great. I really appreciate it. I have just one more follow-up question because I know that we're getting close to our time. As far as digesting beans and a lot of fiber, when people aren't used to that in the beginning, it can be there's a little transition period. Have you seen people who it's been a while, like months, and they've been eating this way and they're still constipated or bloated or having digestion issues?
Yeah, I mean, there could be more to the problem, bacterial overgrowths. It could be what they're putting in. And so a lot of times food diaries are important. I have a dietitian who works with me, that you can link up with, who can help. Because sometimes I think a lot of times people need a little bit more guidance when their guts are sick like that. And so
Mm-hmm.
I have worked with people who have bacterial overgrowth syndromes, and they can't eat, they eat a few pieces of greens and they get nauseous, and
Right.
and so you sometimes have to start very, very slow. I've had patients like increase their lettuce intake or greens intake by like two or three leaves at the beginning. And
Mm-hmm.
sometimes you have to go really, really slow, but I have like a 99% success rate. It just sometimes takes time to get there. The people who are having a couple months later, they definitely need to have some kind of person looking at their food log,
Mm-hmm.
understanding what they're actually putting in their diet, how they're cooking their foods, how they're using their beans. And there's so many little tricks to cutting the gas in terms of pulling off some of the extra bubbles when you're cooking lentils or adding in seaweed. I mean, there's just other things. And sometimes you just need to kind of learn those tricks. But sometimes people have other overgrowths, and they need to have that understood. And having the care of somebody to help you through that is worthwhile.
Yeah. Okay, this has been great. I've learned a ton. It's been fabulous talking with you. I really
Yeah,
appreciate your time and all of the knowledge that you've shared. If people
no
want to
problem.
find out more about you and learn more about you, where do they go?
Yeah, so it's Dr. Monica. So DrMonica. Aggarwal is Aggarwal. I imagine you're going to put that in the show notes. So drmonicaaggarwal.com. I do telehealth, 60-minute telehealth visits. I do have a newsletter that is extremely well received, and it's been a great joy for me as well. That it comes out every Monday. And there's a lot of resources on the website with webinars and education materials that you can pick up and get. So I would encourage people to go on the website, because I know people are going to reach out to me a lot and say, I want to know what I need to do for my heart. And I'll say, okay, well, hold on. Watch the webinar, start there, then watch the second one, maybe there are two or three of them there. There's one even called Nutrition for Heart Disease. So it really kind of goes through the play by play. There's one that's on there about nutrition and how to reduce risk, the Heart Disease Solutions Workshop, and it really goes through the different tests that are available, inflammatory markers. So I'd encourage people to just go on the website and try to find some information there, and then reach out if you're not getting what you need. And I'm happy to see you in the telehealth.
Okay, and we'll put all that in the show notes. Thank you very much, Dr. Monica. Really appreciate it.
My pleasure. Good to see you all. Take care. Bye bye.
Bye.